Good evening, everybody. Sri Dangayash, I think his knowledge of medicine, to say the least, is vast and fairly profound. And I guess it's the managing director of Syntech who could have conceived of creating new paradigms. And I must say that the two books that he referred to, Cancer and Living Dying, he has grasped the essence very well, and more than that, he has expressed it very well to you. I'm really thankful to you, very well. I'm thankful to Dr. Pahuja for the CD that he gave me and the idea that he gave, and I'm thankful to all of you for being with me to share some thoughts on the issue. I think Sri Dangayath referred to philosophy. There's a time when we wrote in 73 a large book on cancer. It was 1,000 pages, and somebody said it's all philosophy. And I went into dictionary and found philosophy is scientia scientiarum. It's the science of all sciences. I have in the house Jayashree Ben Lalbhai, with whose courtesy I came here. I have Justice Ramesh Mehta, I have my sister, I have so many friends. So I am glad to be here, and we shall discuss some things on an even keel. I come to share with you ideas on modern medicine. So let us start with the very word modern medicine. It might delight you to know that the word modern medicine are both Sanskrit. Modern and medicine come from measure, mapa. Map or matra in Sanskrit become modus in Latin, and from modus have come modern medicine, and therefore modern medicine is a kind of tautology, like holistic health, repeating the same word. But dictionary is kind. Medicine is something which is given in an exact measure, 2 milligram, 5 milligram, sometimes 1 gram. So medicine is something which you give in measure. Modern is something which you do after taking into consideration every aspect. So you take a measured step. So when you take a measured step, you are being modern. Largely, we have been asked to understand that modern is sophisticated, imported, latest and costly. In fact, dictionary says modern means that which you have arrived at by putting everything into consideration. Today, a larger part of American physicians believe that angiography, coronary angiography, is a holy humbug. So if you accept that coronary angiography, bypass and angioplasty are three great holy humbugs, you are being merely modern. I think a little love of words will take you to realize that Sanskrit dominates the entire literary scene. I was delighted to find that the word doctor comes from Dig is Disha. Dig Darshak is the one who shows the path. So Dig Darshak becomes director, becomes doctor. Therefore the word doctor is Sanskrit. Then you go further. The word nurse comes from Sneha. Sneha, nourishment, nurture, nurse. Therefore the very profession of nursing is rooted in love. The very profession of medicine, let me tell you, should be rooted in love. I was at the instance of Swami Rangnathanandji, we were in Calcutta, and we had a big meeting on doctor-patient relationship. And the question came, why should I love my patient? Why should I love my patient? Why? And then I was reminded of Chandogya Upanishad, which said, Tat Tvam Asi, the patient is you suffering. And therefore, if you love yourself, the first thing that you must do is to love your patient. And I happened to be in Abu. There were 1,500 homeopaths, and we had to discuss doctor-patient relationship. I happened to be the last speaker. There was very little time left. So I was inspired to sing, which I shall sing before you, which carries the essence of doctor-patient relationship, which we have to bear in mind. I have Dr. Parikh here, And he bears me out that Dr. Ambrose Paré, in the 16th century, he gave a great quotation, I dressed the wound, God healed the wound. I dressed the wound, God healed the wound. So God there. And till today on wound healing we know nothing except the fact that God heals the wound. So allow me to sing for you, and I'm sure you can join. Mariz means a patient. मरीज की मुस्कुराहटों पे हो निसार, मरीज का दर्द मिल सके तो ले उधार, मरीज के वास्ते हो तेरे दिल में प्यार, डॉक्टर इसी का नाम है. We doctors are expected to be well dressed, but never too well dressed, because it intimidates the patient. There is a conversation in New England Journal of Medicine where a patient tells the doctor, Doctor, I am afraid of you because you are too well dressed for me. So we are supposed to be voluntarily poor. माना डॉक्टर देखने में फकीर है, फिर भी यारो दिल के वो अमीर है. माना डॉक्टर देखने में फकीर है, फिर भी यारो दिल के वो अमीर है. मिटे मरीज के लिए वो जिंदगी, करे मरीज के लिए वो बंदगी. किसी को हो न हो हमें है एतबार, डॉक्टर इसी का नाम है. A patient comes to us not by walking, not in car, not on cycle, but on a path of faith. A patient comes faith. Faith. रिश्ता है मरीज के एतबार का, जिंदा है तबीब से नाम प्यार का. You know one thing I tell you, somebody in distress, you look at the person as your own, and if love is dripping from your eyes, much of the patient's illness is likely to be mitigated. We must look at the patient. It's I who am suffering. It's I. It's incidentally. In fact, in Quran it is said that before a doctor goes to a patient, he must thank the God that but for your mathematics, I could be there and the patient could be here. Please remember. रिश्ता है मरीज के एतबार का, जिंदा है तबीब से नाम प्यार का, कि मर के भी मरीज को याद आएंगे, मरीज की आंसुओं में मुस्कुराएंगे. कहेगा हर मरीज मरीज से बार बार, डॉक्टर इसी का नाम है. So first thing, medical science is not an arena of being serious, of being very, no, it is an arena of laughter. And why laughter? Because it's a fraternity of co-sufferers. It's a fraternity of equality. I have patients from all over India. Obviously, they come with cancer and coronary. And the first question from an advanced case, just the last week when I was in Baroda, I went to the rural area and I saw Damji Bhai with an advanced chondrosarcoma. And Damji Bhai's wife asked me, how long will my Pati Dev live? So I said, he can attend my funeral. શું વાત કરો છો સાહેબ? મેં કીધું કે મણિબેન, મરવા માટે કારણ ન હોય. Time controls death. Disease does not produce death. Even in Gita, Lord Krishna says, Kalosmi lokakshaya krutta pravruddha. He did not say rogosmi krutakshaya. Time I am designed to annihilate man. We sometimes say, Sahib card kari gaya. He died. Because most of us don't realize that with each breath, I first inspire, then I expire. Doctors in this house will agree. Dr. Parikh, you agree? I just now expired. I continue to talk to you because the next breath has come. I have a cutting, Jayashri Ben, from Calcutta. One Dr. Banerjee was talking on how to prevent heart attack and he collapsed and died. Most of us have an illusion that we take breath. Today Mr. Nair says, "Sir, will you have chai?" I said no. "Will you have coffee?" I said no. "Will you have pani?" I said yes. You say no when you can say yes. You say yes when you can say no. Is there anyone in this house who will say, "Aaj saans lene ka mera mood nahi. Today I am not in a mood to take breath." Moral of the story, breathing is not under your control. And when you go to sleep, who breathes for you? Supposing this task had to be shared, you tell your wife, "I am going to sleep, you breathe on my behalf." And then she sees Kaun Banega Crorepati and forgets to breathe for you. We hardly realize that you have control on half the breath, not even full the breath. I know that the air which has come in will go out. I do not know whether the air which has gone out will come back or not. Personally, I feel for a good life, to realize the kshanabhangurta of this body is the most important philosophical stake you can take, because I don't like to get angry because I don't know whether the next breath I will be there or not. And Robert Louis Stevenson in East Triplex, he writes, "Life is briefer than the flicker of a matchstick." Life is briefer than the flicker of a mist. Abhi tha, abhi gaya. And look at Sanskrit dictionary. The word deha comes from dahan yogya iti deha. You can confirm it in a dictionary. Dahan yogya iti deha. Dafan yogya iti deha. And the word sharira comes from kshayate iti kshariram. This is in Raghuvans. One that ages every moment is sharira. And significantly, Aishwarya Rai is abbreviated as nothing but ash and rak, which is her destiny. And therefore, a country which realizes that this body is supposed to grey does not go after beauty parlors. We are creating a nation of neurotic people. Kala idhar, gora idhar. Tragedy. We don't meet the person, we meet the dye. So I sometimes say that people who are worried about their grey hair have to dye every day. And about a person coming out of beauty parlor, there was something very well written at the back of a truck. देखने में कितनी हसीन हो मगर अंदर से बिगड़ी हुई मशीन हो. With this preamble, ladies and gentlemen, let us come to so-called illnesses. I had a long discussion with Dr. Shivang Swaminarayan. I am thankful to him for being patient with me, because patient with my erraticness. And the question was what title to give. So I had given Befriending Your Illnesses to Win Them Over. But then he realized it would become too long a title, so it came with Living Well with Illnesses. And therefore the first thing is living well with illness. So let us define what is living well and what is illness. So let us first take illness. Modern medicine has a problem. It has still not defined what is illness. We don't have. You go to dictionary, we have not defined what is fever. We have not defined what is disease. We have forgotten that the word disease comes from French des eyes, lack of ease. Lack of ease. There is a young girl climbing the mountain with her little brother in her arms, and there is a sadhu Maharaj coming from the opposite side, and he says, "Arey bachchi, ye boja kyun utha rahi hai?" तो बच्ची says, "Maharaj, ye boja nahi, ye to mera bhai hai." ये बोझा नहीं है, ये तो मेरा भाई है. Now let's consider a typical checkup center in Ahmedabad and Bombay, London and America. A magical place where a person walks in and a patient walks out. What is a checkup clinic? Checkup clinic is to hold somebody and say, "Don't think you are well, you are ill. Because my investigation has showed that you're supposed to be ill." Right? Now I have a cartoon from Science Digest. Here is the patient, here is the doctor. He opens the file. This light can be put out. He opens the file And he says, "Arey, from my report you should be dead." I'm surprised. "Arey yaar, tu abhi tak jinda hai." Now this is the emphasis we put on an investigation. Forgetting one fact, the word investigation has come from vestige. Asian is a suffix. Investigation means vestige. Vestige means trace. Trace means hardly anything. Therefore, when patients come to me with a large file, I tell them, "Tasveer teri dil mera bahla na sakegi." You know? See the patient. It's not necessary. I rarely order an investigation. And in a very interesting study done in Melbourne General Hospital, they tried to find out how many diagnoses can be reached by history alone. And what is history? Listening to the patient. And you will be amazed, 76% of diagnoses can be clinched by just listening to the patient, realizing that the patient is superior to the doctor. In the first paragraph in our death book says, patients are our only teachers. So some of my postgraduates said, "Sir, how can patient teach you?" I said, patient is superior to in terms of knowledge, because patient has experience of illness. You only have knowledge of illness. Who is superior? Dr. Parikh has eaten a banana, read nothing about it. I have never eaten a banana, but I have read 20 books on the taste of banana. But Dangayach is going to trust him कि इसका स्वाद कैसा है. The first thing you must realize, you people as patients are a notch above the doctor. Clearly. Notch above. Secondly, in the kingdom of the Lord, the patient and the doctor are incidentally on either side of the table, but their right to live and die is equal. Ramakrishna Paramahamsa in Kathamrit, he says, Bhagwan is a hearty laughter. Oh, twice. When Manu says, "I am the landlord," धरती से मेरा तो अभी तक कोई लॉर्ड हुआ नहीं है. ऊपर जल जाएगा, नीचे घुस जाएगा. कौन रहा है? लैंडलॉर्ड. व्हाट इट इज? धरती के कुंभार को तू क्या रून दे बोल. एंड सेकंड, व्हेन मनु सेज, "डोंट वरी, मैं बाजू में, कुछ नहीं होगा." भगवान से, "साला तेरा आयुष्य मेरे हाथ में. व्हाई आर यू अश्योरिंग हिम?" And recently it has happened that I had Dr. Rindan, his relation, went to a doctor, advanced cancer, and the doctor moved the hand on the throat and tells the lady, "Not more than 3 months." And exactly after 3 months, the doctor died. First thing I tell you, I have till the last breath of a patient maintained that your right to live is no lesser than mine, and I mean it. The moment you say that you can attend my funeral, the patient's sense of being victimized by the disease is gone. And surely, you see, because death is a function of time. Death is so precise, it gives a damn for 5-star hospitals. That's why death is called Yamaraj, which is shortening of Niyamraj. Yam Niyam. So Yamaraj is shortening of Niyamraj. Ke death says precise timing. Whereas disease is turning of the body with passage of time. So Swami Niramayanand and I were sitting in the Ramakrishna mission, and he says, "Monu bhai, the human body with the passage of time is subject to two forces, Jora and Vyadhi." I am saying Jora because of this is a Bangla's. Jara is Jarjarit Thaute. From that has come geriatric. So is the passage of time, there is aging of the body. And with aging of the body, you may have pain, means Vyadhi. And what the physician does is to do plus minus in Vyadhi. He can do nothing about Jara. And now let me cite you two big authorities, Sushruta and Charaka. 500 years before Christ described Arbuda, yani ke tumor. This word Abu has come from Arbuda, means tekra, means tumor. And Charaka gave a parlance. He says Arbudas are of two types, Saumya and Ghatak. Look at the terminology. Saumya is benign, Ghatak is malignant. And then Sushruta writes 11 chapters, 14 and 15 slokas, that by the time you feel Arbuda, it has got satellites everywhere. And he suggests, as far as possible, don't touch the Ghatak variety, because the patient will curse you later. Sushruta said this 500 years before Christ. In 1967, when Dr. Borges, the most humanitarian doctor in Tata Memorial Hospital, who himself died of cancer, delivered an oration at Pune, when he said, many a times the patient has come to me later and says, doctor, if I knew this, I wouldn't have got treated. So it took 2,500 years for Borges to repeat what Charaka and Sushruta had said 500 years before Christ. And ladies and gentlemen, I have come to confess before you that in last 2,500 years, medicine has not progressed beyond the spelling of cancer. Now, in case there is a kind of a mirth as to how is it possible, I happen to have gone to Sloan Kettering Institute in 1977. I was with four of us, with the director, who had been brought there because Sloan Kettering Institute faced one of the greatest scientific scandal of the century. One thing I but tell you, America, everything is greatest. Their stupidity, greatest. Their foolishness is greatest. In fact, there is a cartoon of a psychiatrist's anteroom where one patient tells the other, you know, he thinks that my inferiority complex is the greatest he has seen so far. Great. So we come back to Sloan Kettering. There is a big scientific scandal about which we need not talk. Scandal, all right. Then the director says, Manu, you are right about cancer. But now we are so politically and commercially involved that we have no courage to tell the public what is the truth. I am quite close to Tata Memorial Hospital and my friends tell me that Manu bhai, you have prevailed, but still you are in a hopeless minority, so it does not matter. And in 1979, in our smaller version of the book, we wrote that cancer is unresearchable, a chapter that has gone unchallenged so far. I'll tell you what, cancer research will continue because the government is worried about unemployment among the educated. If cancer is not researchable, then what bala cancer is? Let me assure you, Mr. Dangayach has really grasped the essence. The title of our German translation is Cancer a Disease? Is cancer a disease? And the reply is in the negative for the following reasons. Evolution shows that we have evolved from cancer. Therefore, life was preceded by cancer and returns to cancer. That is evolution. Secondly, cancer cell does not differ from a normal cell because medicine does not know what is a normal cell. Albert Jane-Georgi, Nobel laureate, chairing a symposium on cancer, was asked at the end of the symposium, Sir, can you define a cancer cell? He said, how can I define a cancer cell when I can't define a normal cell? So, cancer cell is what it is, for it does what it does, and it does what it does, for it is what it is. Moral of the story, cancer is a normal cell. This is now arrived at. Cancer does not multiply faster than normal cells. Cancer does not have any known chemical agent working against it. Cancer remains silent in the body for 10 to 15 years after it starts. Therefore, early diagnosis of cancer is the greatest lie we medical men have spoken. And finally, cancer does not kill. Now let me come to this. Each life, whether it's an ant, elephant or me, depends on three flows. Water must go in and come out. Food must go in and come out. Air must go in and come out. If these three flows are there, you will continue to live. Even you have no buddhi, no eyes, no limbs, no ears, nothing. Moral of the story, cancer is to be left alone if all the three flows are working well. Dude, because it has been with you. Hardin Jones of National Cancer Institute, Bethesda, from a global survey, came to a conclusion: cancer per se does not kill, and he said that the untreated cases live longer and better than the treated. This is his global survey. Therefore, question is, does cancer have any treatment? And clearly, cancer can't have any treatment because cancer is a part of your personality. Prakriti cannot have osad. Cancer is a part of your personality. And supposing Dr. Parikh is a brilliant cancer surgeon and my wife takes me with my cancer here, so he removes that cancer. He sees that everything is clear, no nodes, nothing. And then he says, then my wife asks, from where did the cancer come? So he will say, it came from his normal cells. So the wife will say, but above and below there are normal cells. Till today, cancer cannot be cured because when you remove the cancer, the next normal cell turns cancerous. The next cell which was not cancerous so far turns, and this in cancerology is known as recruitment or neocanceration. So till today, cancer has no treatment. And another thing is, I was traveling somewhere out of Bombay and somebody phoned me up, "Arey Manu bhai, congratulations, American Cancer Society has now confirmed, which you declared 30-40 years ago, that surgery of cancer precipitates spread." You see, cancer after occurring in the body does not make noise for 5 to 10 years. Brooke of England has called this the discreet wisdom of cancer. It sits like this. Then I go there, move my knife, open up the veins which were not open so far, and the cancer is now made to go from there to the brain. Therefore, surgery of cancer precipitates metastasis. There is no known anti-cancer drug because Karnofsky of Sloan Kettering Institute is on record as saying that agents known to cause cancer in animals should be used against cancer in men. Ladies and gentlemen, till today there is not a single drug. Only thing is, the 5 paisa poison on the emotional ground of cancer is sold for 5,000 to 50,000 rupees. It is the biggest business today, but let me tell you, there is no drug. Same thing for radiotherapy. So till today, cancer has essentially no treatment. તો પછી ડોક્ટર સાહેબ કહો તો ખરા અમારે કરવું શું? Very simple, as Mr. Dangayat says, do not trouble unless trouble troubles you, and trouble your trouble only to the extent that it troubles you. Is that clear? Now, just to my mother at the age of 69 in 1984 died of advanced cancer. We couldn't locate the primary, but she died laughingly and smilingly. So one of my relations said she wanted to prove your point, so she got cancer and died laughingly. See, to teach us a lesson, in my and my co-author's family Lopa, 18 people has had cancer, and I can swear on oath not one was treated, and 17 lived very well, died very well. My father had lung cancer. He lived for 11 years precisely because he was not treated. My mother was not treated. My Masi was not treated. And right now I have my brother-in-law, my wife's brother, who is alive and kicking 16 years after diagnosis of carcinoma larynx, grade 2, confirm again. Therefore, my general point is, cancer can be lived with and died with. There's a very nice statement in Oxford. Out of 400 prostatic cancer, 399 never bother the person. And when the 400 bothers you, modern medicine does not know how to treat. And therefore, if you appreciate that any one of us can have cancer, if you appreciate that by the time you detect the cancer on a scan, it is in your body for 10 to 15 years. If it is in your body for 10 to 15 years when you detect it, it can be in your body for another 10 to 15 years after you detect it. And therefore, cancer can be befriended. And if cancer can be befriended, you can win it over. When you can win it over, you need not treat it. After all, what is friendship? In French, there is a saying, "Ça tu comprender, ça tu pardonner." To understand is to forgive. To forgive is to accept. To accept is to befriend. To befriend is to have a dialogue. To have a dialogue is to have to trust another person. To have the trust is to tackle the other party in a mood of friendship. Should you get cancer? First thing is, no treatment remains still the best treatment. Secondly, whatever treatment give is no treatment but palliation. There is a term which most of you must have heard, palliation, especially doctors. Palliation comes from pallbearer, Ram Bolo Bhai Ram. Honestly. And palliation means the doctor declares to the patient that I am now putting the disease in a coffin because about the disease I don't understand anything. Now you tell me, if you got khasi, I will give you codeine syrup. If you have got pain, I'll give you this. And when it comes to pain, let me assure this house that cancer secretes morphine in the human body. And that is why pain in cancer is after the treatment, not before the treatment. That's why cancer can afford to live within your body for a long time without causing any pain. We have written a chapter for an American text where we have shown after you cut the cancer, after you radiate the cancer, after you give chemotherapy, you disturb the morphine cycle and pain starts. Therefore, cancer is not. And finally, rightly Mr. Danga says, cancer has no cause. I can't agree even with anti-Gutka people because I have worked at Tata Memorial Hospital, Tata TIFR for 30 years on oral cancer and pre-cancer. Cancer has no cause, not at all. Mark Twain, when he was 70 and bursting with health, he was asked, what is the secret of his vitality? He said, I have made two simple rules in my life. I never smoke when I am asleep. And I never drink when I am alone, and by and large I am in good company. And Churchill, when he was 80, he smoked like a chimney and drank like a fish. So a press photographer went and clicked him and he says, sir, I hope to photograph you next year also. Churchill said, why not, young man? I see nothing wrong with you. I come to a very thorny issue. I am told the government of India is going to set up an institution on change in lifestyle. When you go to a doctor, oh, you have a heart attack because you had a wrong lifestyle. You have cancer because you had a wrong lifestyle. You have this because of a wrong lifestyle. I tell you, my experience is the body accommodates a lot. Nature accommodates a lot. And we have no relationship we have found with lifestyle and disease. And therefore, one of the commonest tablet which I prescribe to all my patients is KPM, Khao Pio and Maja Karo. Because we don't have proof. We don't have proof that smoking causes cancer. We don't have proof that this causes that. In fact, if you really were to insist, smoking is negatively related with Parkinsonism, Alzheimer's, bowel cancer and brain cancer. Therefore, supposing I stop your smoking tomorrow and you get bowel cancer, in America you will drag me to the court of law. That he knew that smoking prevents bowel cancer. He asked me to give up smoking. I gave up smoking. Now I have bowel cancer. Now he must give me $1 billion in damages. Therefore, I conclude on this very vital issue, cancer. A, that cancer is a part of your program predetermined before you were born. Secondly, cancer is a social obligation. Social. When I see a patient, I say, look, for me, you are Jesus Christ or you are Lord Shiva. He says, how? I was sitting in a rural area. There is a Mohammedan patient coming to me with a galpata. I unwrapped and he had laryngeal cancer, exuding pus because he had been irradiated. So I said, thank you for suffering on my behalf. He says, why? I said, you got it, therefore I didn't get it. It's a universal law. Out of 5 human beings, 1 person will take the burden of getting cancer. Because 1 person got the burden of getting cancer, the 4 have been spared. Therefore, the 4 owe a duty to the person who got cancer. When my colleagues Lopa's father got at a young age of 80 blood cancer. That particular blood cancer occurs 1 in 33,000 world over. So I told him, Kaka, because you have got this, 32,999 have been spared of this cancer. Therefore, a person who gets cancer is not a bichara. A person who gets cancer is a social service member who is taking upon himself bearing the cross for others, like Jesus Christ or like Lord Shiva. After Samudra Manthan was done, he drank the poison so that you don't have to drink it, and we called it Nilkant. Cancer can be lived with very comfortably. I end with two great examples and we go to then next disease. My book was introduced to the world by Ivan Illich, one of the leading thinkers. After he introduced the book, in 78, he got a parotid tumor. He decided, I am not going to get operated. So he allowed the parotid tumor to grow to a weight of 1 kilo. And he died recently on 6th December 2002, 24 years with parotid tumor. And Alexander Solzhenitsyn, the Russian Tolstoy, in recent times, in 1955, his stomach was opened and he was declared inoperable cancer, not more than 3 months. Today he is still alive. Number of books, Nobel Prize. I have a number of cases where the doctor said not more than 6 months and the patient has lived on for 30 years because cancer by itself does not kill. We now go to next. Coronary artery disease. Now the question is, till today modern medicine does not have definition of coronary artery disease. Does not have. So people ask me, what is coronary artery disease? I'll put it this way. If hair can grey, eyes can develop a cataract, cells can age to develop cancer, coronary arteries with age can develop a block. So you call it coronary artery disease. Now we have three funny situations. Arteries which are plumb normal can end up in heart attack. In arteries which are advanced block, the person carries on up to 80 years of age. We have not been able to connect coronary blockage with heart disease. We have not. And secondly, a person comes to you, you look at the angiogram, and then now there is trouble. When you look at angiogram, the same angiogram shown to the same cardiologist on 3 different occasions, 3 different readings, the same angiogram shown to 3 cardiologists, 3 different readings. Till today, we do not know whether angiogram is read well or not. But more than anything, nature does bypasses on its own. If your heart is working well, you may have multiple blockage. There is no need to tamper with the blockage on one simple principle which is known as principle of garbage clearance. Ahmedabad is a clean city. Bombay is not. Bombay is सोने के लोटे में गटर का पानी right now. But in Bombay, I see for myself that the garbage is never removed. It is relocated elsewhere. From my house it is taken and dumped behind Mother Teresa's home in Borivali, near, well beyond, close to the sea coast. In any city, garbage is never removed, it is relocated. Today America has got 6 million garbage dumps. It doesn't know what to do. If you have a coronary garbage, say my coronaries are clogged, and if you do bypass or if you do angioplasty, you dislodge the garbage. It goes to the path of least resistance, it goes to the brain. Ladies and gentlemen, New England Journal of Medicine 2002 avers the fact that during bypass and angioplasty, the brain is damaged in 100% of cases. That the kachra taken out from the coronary goes straight to the brain and causes minor to major symptoms. It manifests itself in 54% of people, ranging from mild depression to a stroke. And therefore, bypass is dangerous. Angioplasty is dangerous. And above everything, the stent which is there is anti-physiologic, because the function of the artery is to contract, then expand, contract and expand. With a stent, the artery is paralyzed in distension, the artery is destroyed. And finally, ladies and gentlemen, Some doctors are here, they can refer to Harrison's Principle of Internal Medicine, now in 2 volumes. Till 1980 it was in 1 volume, 8th edition, 2 volumes, now today 16th edition. For the last 25 years, one particular paragraph does not change, namely on coronary bypass. And it goes as follows: we do not know how bypass works. Why they have said that? That quite often after doing bypass, the bypass closes down in 3 months, but the patient remains well. Therefore, the following are the 3 theories. 1, placebo effect. खर्च करने का आनंद सबसे बड़ी बात है. In coronary, खर्च करने का आनंद. And one angiography text says that in as many as 64% of people, the heart remains unchanged, but he feels nice. That after all, spending 5 lakhs of rupees, I must feel nice. Even the wife would say that I have sold my Mangat Sutra. Now at least today you should feel nice. The second is sensory neurectomy. The nerves are cut. The heart remains bossed up as before, but the fellow doesn't develop a frenzied reaction. I was told about Ahmedabad. One doctor was driving and took a sharp left turn. So the wife says, "Tame aa turn karcho mane bahut dar lage chhe." So husband says, "You do what I do." She says, "What?" He says, "I close my eyes and take the turn." So when you do sensory neurectomy, the heart remains bossed up as before, but you don't know. And finally the textbook says, which you can confirm, mostly, he says, mostly bypass relieves pain by infarcting the ischemic segment. Moral of the story, bypass relieves your pain by killing that segment of your heart which before bypass was complaining. During bypass, that segment dies. The nerves in that segment dies. The nerve in that segment dies. Your pain disappears. Jang jityo re maro kaaniyo, wo chale tab jaaniyo, you know. So bypass becomes a way of doing. Gujaratis will understand. Tamare jo lakh na 12,000 karwa hoy, to bypass karo. See. Now somebody will say that after all so many people survive, but you may survive despite the bypass. You are forgetting that you may survive despite the bypass. I'll tell you what, angiography started in 1952. Bypass started in about 1956. Angioplasty started in 1966. But you will be surprised that the whole business of bypass is exactly 106 years old, because it started first in 1899. But it is vanya vanya, phir bhi toda. Either this procedure, that procedure. I must tell you that till today, bypass, angiography, angioplasty and stent, unfortunately, do not have any scientific validity. None. None. There is no drug which we can safely prescribe. None. In fact, most drugs prescribed for heart weaken the heart. Doctors go by this theory that his heart allegedly receives less blood, so the heart should work less. So they give drugs for the heart to work less, beta blocker, calcium channel blockers, ACE inhibitors, so the heart works less. So heart gives out less blood. So the coronary receives less blood. Therefore, like in cancer, all cardiac drugs end up hurting the heart. So what should we do? Simple. A, accept that with age, heart, like your hair, should age. Clear? Kshayate iti kshariram. Secondly, a diseased heart is no parwana for death. A healthy heart is no parwana for life. Therefore, to my heart patients, I give them 3 mantras. Firstly, Allah मेहरबान तो इंसान पहलवान. Secondly, राम रखेगा तो मुझे कोई नहीं चखेगा. And thirdly, राम चखेगा तो डॉक्टर को भी कोई नहीं रखेगा. तो first, the most important thing that a patient must be told, that given this disease, my chances of survival are no greater than yours. With all reports normal, be ready to die, because death comes every breath. In fact, in Sakar Jagat, because there is dark, there is light. Because there is tall, there is short. Because there is day, there is night. Death can't exist in isolation without life. Therefore, life, death, life, death, life, death. When I stop dying, you say, Manu bhai guzari gaya. Manu bhai is neither alive nor dying. Is this clear? Therefore, death has a new definition. Death is perpetually with you. And if you have read Carlos Castaneda, of late I find TV has taken away the right to read. But supposing you have read Carlos Castaneda, in Journey to Extraline, Carlos Castaneda asked Nova, why are you always happy? Why are you always relaxed? He said, I have a friend walking with me, overlooking my left shoulder. So he says, who is your friend? He says, my death is my friend. He tells me that nothing is so trivial as to be neglected. Nothing is so serious as to be worried about. And after all, we should all realize I am standing in the best management institution in India. Best Ahmedabad Management Association reminds me of another great association that is in America, American Medical Association. I think Ahmedabad Management Association is far more honest, far more advanced. I am told it is. I have heard nothing but praise for AMA, for its integrity. Ahmedabad is one of the great cities in India because it nurtures the best institutions. I am here, which has been founded by Vikram Sarabhai and Kasturbai Lalbhai and group, and I am happy to be here, honestly. I feel proud. This is one of my great moments to stand before you in Ahmedabad Management Association, and I am very sure, with the lead given by Danga H and all, Ahmedabad can lead the entire country. I compliment Ahmedabad, and I wish Ahmedabad great luck that one day people from Bombay would say that I am going to Ahmedabad for higher studies. That can happen. People from Harvard will say that you are going for higher study. We come back to management. How do we manage ourselves? You have heard of Rockefeller Foundation. Rockefeller Foundation is a great medical institution in America. It recently came out with a book. The title is Doing Better and Feeling Worse, Health in the United States. Now, what is doing better and feeling worse? Until recently, that is the 60s and 70s, US has spent $8 billion a year on health. $8 billion a year on health. Today, America is spending $3.3 billion a day. From $8 billion a year to $3.3 billion a day. Establishments are doing better. Patients are feeling worse. And in the very first chapter by Louis Thomas, he owns up that modern medicine knows next to nothing about cancer, coronary, high blood pressure, stroke, diabetes, arthritis, peptic ulcer and depression. Many of you must be under treatment for high blood pressure. I have only one question. Who gave you 120 upon 80? Who gave you 120 upon 80? Who gave you? And this is a secret not revealed to you by medical man. I have a book by 3 Americans, High Blood Pressure in Search of Definition. And there it has been shown that one American insurance company surveyed people and came to a conclusion that if they keep this figure of 120 upon 80, they will be able to charge a higher premium to a larger population of people, 120 upon 80. So 120 upon 80 is foisted on mankind by an insurance company, and I am ashamed that we doctors have left it up. Till today, nobody knows where normal pressure ends and abnormal begins. Nobody knows. In fact, the word normal can never be applied to an individual because people in mathematics know of normal distribution. Normality is always a herd, is a group, never at an individual level. And I am ashamed to say that the Vepla, which is associated with antihypertensive drugs, is a lifetime business. They stamp you as high blood pressure. Then once and forever you are high blood pressure and the company keeps on making money. Thank God that 2 weeks ago, America declared that ghee खाने से हार्ट अटैक होता नहीं. तो खाना है तो चपाती को घी में डुबा के Because after all, at an older age, you like to chew your food well. And I tell them, you want to lubricate your arteries, eat ghee. Ghee will go and lubricate the artery. If the artery is lubricated, the blood will flow well. Long ago, the era of diet has come to an end. Ladies and gentlemen, I wish to assure you of one thing. It is not what you eat, but how you eat. It's not what you eat, but with what gratefulness, thanking God you eat. It's not what you eat, but how much you need. It's not what you eat, but how deliberately and slowly you eat, that any food is good. I don't think, in fact, to come to dining table and you say, "Ye mujhe nahi pasand hai," it is tantamounts to insulting God, because the only God that I know is the food in my plate. I'll give you an example. Supposing there is a chapati lying in my table, in my plate. Is the chapati sustaining me or I am sustaining the chapati? Chapati is sustaining me. So je jivade છે તે શિવ ને જીવે છે તે જીવ. So when you eat, is Shiv meeting Jiv. Therefore it is the biggest prayer you can do on earth is to eat. Now this Shiva is partyless. It will sustain an ant, an elephant, a dog, a Muslim, a Christian, a non-believer. Therefore this is the only God. All those temples are creating corals. Why you get well on food and never on drugs? Because drugs cannot be converted into body. Your food is nothing else but your body. It becomes Shariri Karan. When Manu eats chapati, there is Manu Karan of food. And therefore, in all illnesses, the most important thing to do is to eat. But with one clarity. If you go to Isopanishad, the first is Isavasham idam sarvam yat kinchit jagatyam jagat tena tyaktena bhunjitaha tena taktena bhunjitaha. Why did he say that? You call Bill Gates, you call Premji, you call one of the Ambanis to your place and serve them a chapati and then tell them, iska tyag karke iska bhog karo. Kyun? Ki chapati, fortunately or unfortunately, is not man-made. Is not Bill Gates made. A drop of water is not Bill Gates made. Therefore it does not belong to Bill Gates. Food, water and air do not belong to us. This flower does not belong to me. I have to first confess that this flower does not belong to me because I have not made it. So I have to do tyaga. Then I can enjoy the flower the way I enjoy a sunset, sunrise or a chapati. When you do the tyaga, two things come. Firstly, you thank the Lord for a chapati. You thank the Lord. Kya baat hai, chapati mil gaya. And secondly, you never overeat because it doesn't belong to you. Tena tyaktena bhunjitaha magrit kashyas viddanam. Shastra says, whose dhan is it? It is nobody's dhan. And therefore Shastra says, don't be gidada. Magrit. Don't be a gidada, don't be a vulture and take away somebody's right. If I have to really learn anything in life, is the fact that today 70% of the mankind doesn't know whether the next meal will arrive or not. So we need to eat with a sense. उसके बाद जो खाना है वो खाओ, उसका अमृत हो जाएगा. I remember Dr. T.M. Sodha in Karachi. One old lady gets a prescription, goes to the doctor and comes and says, Doctor, mare khichdi khawai. Manji khichdi khawai. Then she comes back, mare kadhi khawai, kadhi khawai. When she comes back for mare papad khawai ke nahi, to ke mata maji doctor matha se badhu જ khawai. One thing remains certain. We have come to the end of the diet era. This causes this causes this. I will only say, the only thing food can cause is pleasure, provided you are ready to thank the Lord for the gift that has arrived in your thali. And we Gujus should take lead in avoiding 101 items in a marriage party. Because an average Gujarati can't digest more than 4 puris and a little bhaji. If you are suffering from money, for heaven's sake, don't squander it on food which is going to upset everybody's stomach after marriage. Ladies and gentlemen, we are done with coronary artery disease. There is enough proof that if you continue to walk, it's good for your heart. If you continue to work, it is good for your heart. If you eat little slowly, it's good for your heart. And remember, modern medicine has nothing to offer to you except some relief of your symptoms, because we have not been able to define heart attack, we have not been able to define high blood pressure, we don't know. We now come to a major illness called stroke, Pakshghat. One Scandinavian survey shows that just as hair grey with age, and it is age related, just as at 42 you need reading glasses, stroke occurs as a part of aging. Stroke occurs as a part of aging from 8 to 80 years of age. Stroke does not kill. If I die just now, you will declare as heart attack. I did not get heart attack and I died. Because I was to die, I got heart attack. This is most important. There was a time when Mukesh, Mohammad Rafi, Peter Sellers and Uttam Kumar, 4 stars, all died at the age of 54 with heart attack. They did not die of heart attack, but because death was near, the heart attack became fatal. This is clear. So stroke is something where you develop Pakshghat. It occurs 1 out of 10, but the occurrence of stroke is no guarantee for death. And Louis Pasteur, after a major stroke at the age of 47, lived up to 74 years, full of life and vitality. So we have covered high blood pressure, stroke, diabetes and cancer. These are part of your personality. You are participating in a herd, and till such time any one of them creates any problem, leave them alone. When you leave them alone, you understand. When you understand, you befriend them, and there you can enjoy good, full life. Whatever few symptoms you have, A, try to tolerate. B, do the minimum. And thirdly, with all reports normal, be ready to die. And with all reports abnormal, be ready for me to die. So while I am in a group of people who are generous and very well off, but we need to consider a sense of detachment which must come to all of us. The question is, do I own the Mercedes or the Mercedes owns me? If somebody scratches the Mercedes, your sleep is lost. If you die, nothing happens to Mercedes, so who is the boss? Clear? So Ashtavakra Muni was camping outside Janakpuri, and Janak Videhi went to him, did pranam and said, Maharaj. So Maharaj says, what have you come for? So the king says, I have come to have some Atma Jnana. So the Swami says, what will you give in Dakshina? He says, take half my kingdom. Swami did like this. Take my full kingdom. Swami did like this. So the king says, Maharaj, is this not enough? He said, Rajan, give something which is yours. So he says, I'll show you document. I am the king. Even Narendra Modi has certified as true copy. So the Muni said, Rajan, was the kingdom there before you were born? He said, so you did not bring the kingdom with you? Have you tied the kingdom round your neck to see me? He said, no. After you died, will you take the kingdom with you? He said, no. So Rajan, kingdom does not belong to you. You belong to kingdom. The bungalow does not belong to you. You belong to the bungalow. The ornament don't belong to you. You belong to ornament. So the Raja says, then what is it that I own? What is it? He says, Rajan, give me your mind. Give me your man. Because it is your man which is there in this lecture theatre, in the swimming pool, in the hotel. Even in your sleep it is there. So ladies and gentlemen, the only possession you and I have is our man. And since I am poor, I like to keep my sole possession a little well polished because I realize even this body is not mine. इसको भी छोड़ के जाना पड़ेगा. If we are very well qualified, remember our Shastras have been kind enough to consider degrees. You know what is the Sanskrit equivalent for a qualification? Supposing somebody says, I am MS, FRCS, WBC, RBC, LLB, SHOLLB. What is the degree? A degree in our language is called Upadhi. Most significant degree in our language is a Upadhi. And remember, the educated man has destroyed and ravaged the earth. The uneducated has not. In the history of mankind, no saint has ever been educated. And no educated man ever became a saint. It needs Kabir. You know, look at Kabir's Kalpana. पूरे जंगल की कलम बनाई, पूरे जंगल की कलम बनाई, 7 समंदर की साही, आकाश को कागज बनायो परंतु हरिगुण लिखी ना चाहिए. देह देह में विदेह है साहेब सुकृत स्वरूप, तिनी लोक में रमी रहा जाके रंग अनुरूप. Therefore, a society which learns only to earn is a tragic society. And Vinoba wrote long ago, in a society where everybody has to earn, that society eventually gets destroyed. I'll explain. If I am doing nokri, I will have to say good morning sir to a rascal, because I am doing nokri. If I am in private practice, if Dawood Ibrahim comes, I am supposed to treat him. Therefore, compulsion to earn is a tragic compulsion. There was a time when there was a very popular saying, Sa Vidya Ya Vimuktaye. Knowledge is that which liberates you. Liberates you from opinion, from possession, from power. Liberates. Now Vidya is weighed on a weighing balance. Itna qualification, itna paisa aana hai padega. In fact, the more educated you are, the lighter you should be. We shall discuss this issue of knowledge. How many minutes I have? 15 minutes. अभी कितना बज गया? अभी तो 8 में 5 है. अच्छा, 15 minutes? Okay. Half an hour? May I have a glass of water, sir? आप जो भी कहेंगे. Thank you. A whole new science of epistemology has come, which is the science of knowledge. It is the science of knowledge. It's called epistemology or gnoseology, which takes any piece of knowledge and tells you with what you can do with it and what you can't. 250 years ago, an apple fell on the bald head of Newton and gravitation was born. After that, we know everything about gravitation except the fact you can't alter gravitation. So knowing does not allow you to alter it. We know everything about cancer cell except the fact cancer cell won't listen to us. We know everything about coronary except the fact coronary will not listen to you. Therefore, don't be obsessed about research, because research is nothing but animal blood. Today, allopathy is in a crisis, moral crisis, because it has slaughtered animals on a trillion scale. We are little worried about our flu, and birds have no right to live. And I'll tell you what, the word animal comes from anima, means atma. When mind rides over atma, man is born. Mind is dangerous. Dangerous area. You go to Bronx Museum, there is a specimen of dangerous animals, cobra, python, tiger, and the last specimen is a full-length mirror. They write, you are looking at the most dangerous species on earth. And Edward Wilson, who has spent a lifetime on the ant, has said, if the ant disappears because of pesticide, 100,000 plant species will vanish. If because of final atomic Diwali mankind disappears, the earth will be Sujalam, Sufalam, Malaja, Shitlam in next 50 years. So we are not very important. And don't tell anybody ke salo kutra jevo che, because Lord Byron, when he buried his dog, has given a tribute to his dog which I would love to earn. Here lies Botswana. He had beauty without vanity, strength without arrogance, courage without insolence, and all the virtues of man without his vices. This you can't say about even Mahatma Gandhi. Let us go a little further. Shankaracharya in the 9th century said, if Gnana is Ananta, so is Ajnana. If Gnana is Ananta, so is Ajnana. But Pascal put it more graphically. He said, knowledge is the inner surface of a sphere whose outer surface is painted with ignorance. The moral of the story, the moment Manu knows X, he is ignorant by 10x. Therefore, the most learned people only know how ignorant they are. And therefore, it's only the most learned people who are genuinely humble, because they only know how ignorant they are, remember. And that is why we come to this Vignaharta. Ganapati is not Ganapati, it is Jnanapati. It is Jnanesh. And I am asking this house, how this elephantine god has been given a mouse as his vehicle. Ambama has got tiger, Vishnu has got Garud, Yamaraja has got buffalo. But this elephant has got a mouse. Why? Because Shastra says, the more learned you are, the lighter you should be, so that even a mouse can carry you around. Is this clear? So on behalf of doctors, I conclude on an Advaitic note. It is not your cancer, it is you, because cancer cells and you don't differ. It is not your heart attack, it is you. It's not your tumor, it's you. Therefore, before you marry any treatment, remember, it is you who is going to suffer. You. And now we know that we have come from cancer cells. Cancer cells are normal cells. And therefore, your pus, your shit, your tumor is nothing but you. A chamchi, a spoonful of pus, has more divinity than all the temples put together, because the pus has got DNA. D for development, Brahma, N for nurture is Vishnu, A for annihilation of Shiva. Therefore, DNA is Trimurti. It is Brahma, Vishnu, Mahesh. It is Bravima, Bravishi. And it's the same DNA which is everywhere. And therefore, we conclude with a very beautiful poem by Tukdoji Maharaj. He is a Maharashtra saint. This is written in Hindi, but it infuses you with a sense of oneness. When you see your own tumor, it's your own child. When you see your mother's tumor, it is nothing but your mother. And therefore, before attacking the tumor, think thrice, because it is your own mother. Your all diseases come from you. Therefore, never dissociate your disease from yourself. I want to get rid of my cold. Like a Badari who had kept his monkey, gave him a hathoda and said, I am going to sleep. If somebody comes and disturb me. So one mosquito came and started disturbing. The monkey had been told, anybody comes and disturb, you hit. No disease comes without wisdom. No disease comes with ill intention. No disease is separate from you. Every disease is nothing but you. Your grey hair is you. Your cataract is you. Your cancer is you. Your coronary is you. Your arthritis is you. It's you, nothing else. Is it right? Therefore, do not dissociate yourself. In the day you see goodness in your disease, you will have forgiven your disease and befriended your disease. We come to Tukdoji Maharaj. सब देश में तू, सब वेश में तू, तेरे नाम अनेक तू एक ही है. Look at the sweep that a poet has. सब देश में तू, सब वेश में तू, तेरे नाम अनेक तू एक ही है, तेरी रंग भूमि यह विश्व भरा, सब खेल में मेल में तू ही तू है. I had gone to see a rich lady in Sion. So cancer here spread. Doctor સાહેબ હું શું ખાઉં? So I said શ્રીનાથજીનો મોનથાળ, શ્રીનાથજીનો થોર. Why not? મને કે હું શ્રીનાથજીના દર્શન કરી આવું. મેં કરી આવો ખરા, પણ શ્રીનાથજીની સામે કમ્પ્લેન ન કરતા. મને કે કેમ? મેં કીધું આ કેન્સર સામે કમ્પ્લેન કરી તો શ્રીનાથજી કહે હું ત્યાં જ બેઠો છું યાર, એટલે મારી સામે કમ્પ્લેન તારે કરવાની ન હોય. નો કેન્સર ટિલ ટુડે હેઝ અરીઝન એઝ અ wrath of God. Cancer is God itself. Cancer is Lord Shiva. Therefore, don't curse your cancer. I tell you what, we don't see God. Swami Ananyanandji went to Badrinath, 1930, and an old blind man of 75 was trying to go up. At that time, you had to walk 10 kilometers from the nearest bus stop. So Ananyanandji took him all around, brought him back, but then asked him, when you could not see, why didn't you come here? He says, I know I can't see, but he can see me. So God, in fact, the question is not where is God, the question where God is not. So we go back to Tukloji Maharaj. सब देश में तू, सब वेश में तू, तेरे नाम अनेक तू एक ही है, तेरी रंग भूमि यह विश्व भरा, सब खेल में मेल में तू ही तू है. Till today, honestly, I have never complained against heat, whether of Ahmedabad or Rajkot. I am from Rajkot. Because I know that unless it rains 9 months upward, it won't rain 3 months downwards. Kabul? सागर से उठा बादल बन के, बादल से गिरा जल हो करके, फिर नहर बना नदिया गहरी, तेरे भिन्न प्रकार तू एक ही है. Now, it is India which has given the concept of ahimsa. So a mungi or a kidi is as pavitra as anybody else. So here goes to चीटी से भी अणु परमाणु बना. चीटी in Marathi is कीड़ी. चीटी से भी अणु परमाणु बना, सब दिव्य जगत का रूप लिया, कहीं पर्वत वृक्ष विचार बना, सौंदर्य तेरा तू एक ही है. And finally, whether you people accept or not, each one of you is God incarnate. Because God can't make anything but God. There is a Sufi story. One man wanted to see Allah. So he did lot of tapasya. Allah gave an appointment. Come to Oberoi, 303 room. So this fellow goes and lagaus bell. Allah bolta hai, who's there? He says, tera banda baar khada hai. Allah says, this is not the time. This repeated. Finally, the Oliya goes against and rings the bell. Allah says, who's there? He said, yaar, tu hi baar khada hai, khol na yaar. To Allah ne khol diya. So each one of you is God incarnate. Each one of you, like it or not, will not die because you were never born. When Lord Krishna says, na jayate mriyate va, na jayate jaymane sharire, na hanyate hanyamane sharire. Somebody thought Krishna has a poetic license. Sir, please raise your left thumb. I am asking you. Raise your left thumb. Yeah. This is LTI in the bank, left thumb impression. Right? This is more valid than your signature. Because even your right thumb does not have the same impression. Your Jodia Bhai does not have. Therefore, your thumb impression is na bhuto, na bhavishyati, na vartman. Is that clear? How did you manage this? When you were being formed in your mother's womb, you were told, don't make it like Dr. Pauja. Don't make it like the managing director of Syntax. Don't make it like Manu Kothari. Don't make it like Christ. Don't make it like Buddha. So you told Bhagwan, you show me all the thumbprints. Knowing them, I will exclude them. It is called tight principle in physics. Total inclusion allows total exclusion. So when you were being formed, Christ came and showed his thumb. Mahatma Gandhi came and showed his thumb. And they came and showed your thumb because you have showed your thumb to Christ. Is it clear? So you were there when Christ was there. You are now. You are everywhere in the world. You will continue to be there. So the saying that Sahajanandi Suddha Sarupi Avinashi Hu Atma Sarup Deha Mare Che Hu Nathi. Is this clear? Each one of you is immortal. Each one of you is not born. Therefore you cannot die. The last stanza is यह दिव्य दिखाया है जिसने वह है गुरुदेव की पूर्ण दया टुकड़ा कहे और न कोई द्विजा बस मैं और तू सब एक ही है.